listener, and welcome to the Southern 7 podcast. I do hope this isn't your first time joining us, but if it is, I'm Shauna Ryan, Community Outreach Coordinator for Southern 7 Health Department and Head Start. The Southern 7 podcast is a service provided by Southern 7 Health Department to help you and your family live better and stay healthy, and is recorded at our central office in Olin, Illinois. Southern 7 serves the lower 7 counties of Illinois with public health clinic sites and Head Start centers in each of the counties we serve. If you like today's episode, please share it with a friend. And if you haven't done so, make sure to check out our other podcasts on the Southern 7 app, on Spotify, and through our website at southern7.org. Well, listener, one of two things has just happened. You've either just joined our Cancer Warriors Walk for Hope series for the first time to learn about this year's Cancer Warriors Walk for Hope coming to Metropolis, Illinois on October 5th, or you're ready for our second episode. Either way, welcome. But if you haven't heard episode 1 yet, we do encourage you to go back and listen when you get a chance, okay? For now, stay with us for episode 2, Critical Access Hospitals, Advancing Cancer Care. For generations, people who live in rural America have only seen their local hospital for primary health care. But in the face of cancer, that is changing. Local rural hospitals, also known as critical access hospitals, are meeting the needs of cancer patients like never before. In this episode, you'll hear from our 3 regional hospitals, Massac Memorial Hospital, Hardin County General Hospital, and Union County Hospital, and how they are working with oncologists throughout the tri-state area and beyond to help treat their patients closer to home. So here we go, episode 2, Critical Access Hospitals, Advancing Cancer Care.
Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
The second annual Cancer Warriors Walk for Hope is coming October 5th from 10 to 2 at the Dorothy Miller Park in Metropolis, Illinois. Your whole family will enjoy this one-of-a-kind event, complete with games, food, and activities, a tour through a 20-foot inflatable colon, the chance to meet local cancer care providers, and so much more. It all starts with the Warriors dedication ceremony at the Hope Light Lighthouse at 10 a.m., followed by the walk along Memorial Path on the banks of the Ohio River. All proceeds benefit cancer programs in Southern Illinois. For more information, visit Cancer Warriors Walk for Hope on Facebook or call 618-634-2297. Presented in partnership by Hardin County General Hospital, Massac Memorial Hospital, Union County Hospital, Rural Health Incorporated, Community Health and Emergency Services, Southern 7 Health Department, and the Hope Light Foundation. Welcome back to the Southern 7 podcast. I'm Shauna Ryan here at Southern 7 Health Department. And if you've been listening to all of our Cancer Walk podcasts, in this podcast, we're going to be talking with predominantly just our hospitals in our region that are participating in this effort. And these aren't all of them. These are the majority, but not all. And I wanted to give you an opportunity to learn a little bit more about them and the services that they provide to our folks here in our region. If this is your first Cancer Walk podcast, we do invite you to listen to our other 2 in the series. Just go back to where you got this one, and the other 2 should be there as well. But if you're new to what we're doing here, basically on October 5th, we're going to be having our annual Cancer Warriors Walk for Hope at the Dorothy Miller Park in Metropolis. And this is an opportunity for you to come out and get some cancer information, to talk with healthcare providers inside the lower 7 counties of Illinois, as well as outside. But just an opportunity to get to know folks and to get information that you need, either on your own cancer journey with yourself or a family member, or maybe you're just wanting some information. So this promises to be a day of fun. It's not all cancer. They're going to have all kinds of stuff there that day, but we just wanted to make sure that you had a little bit of a heads up on what's going on and give you a chance to meet some of the folks right now that are going to be out there. So I'm just going to go around and let you all introduce yourselves once again, or maybe for somebody, if we've got a new listener on this, that way they can know who you are. And Todd, we'll just start with you. Tell us who you are, where you're from.
All right, my name's Todd Carr. I'm the Chief Quality Officer at Hardin County General Hospital in Rosiclare, Illinois, a 25-bed critical access hospital in southeastern Illinois, in Rosiclare, Illinois, on the Ohio River.
Okay, very good, Todd. Good to see you. Dr. Walters.
Hi, yes, Dr. Walters. I work with Massac Memorial Hospital. I'm the chief medical officer of the hospital. We are a 25-bed critical access hospital in Metropolis, just off of I-24 outside of Kentucky. Very, very, very south.
He's down there in literally the tip of the state of Illinois.
Southern tip, yep.
Southern
Where the
tip.
Superman statue is.
Yeah, exactly. Sarah.
Hi, I'm Sarah Chavez. I'm the Assistant Director of Community Outreach at Siteman Cancer Center. And so our role is to help patients with accessing services and providing information to our community partners.
Very good. Thank you, Sarah. Keisha?
Hi, everyone. I'm Keisha Wyndham. I am also with Siteman Cancer Center's program for the elimination of cancer disparities, also known as PCAD, where I serve as the Assistant Director of Outreach. We do a lot of initial cancer screenings in PCAD.
Okay, great. Keisha, thank you. Harry?
Hello to everybody on the podcast today. My name is Harry Brockus. I'm the Chief Administrative Officer at Deaconess, Illinois, Union County, located in Anna, Illinois. I've been working here for the past 2.5 years. So glad to be here.
Very good. Great. And thank you so much, Harry, for being with us. We do appreciate it. And Don, tell us who you are and where you're from. He may be having audio issues again. Okay. Well, Don is with Massac Memorial Hospital. We'll have him introduce himself once he gets up and running. But like I said, this podcast is just focusing on the hospitals that are involved in this effort. And I believe he's on. Don, are you with us?
Yes, I am. Can you hear me okay?
We sure can. Tell us who you are and where you're from.
All right. Don Robbins, CEO at Massac Memorial Hospital, and excited to be on the podcast today.
Very good. Well, thank you, Don. I'm so excited to have our 3 hospitals in our region on this call today. This is exciting to make sure that we have everybody on, as well as Siteman Cancer Center, who always partners with us in this effort and is wonderful to work with. So we appreciate that. If you are a new listener to the Cancer Walk podcast, like I say, we're just going to kind of go back over a little bit about what we touched on earlier, and we're just going to expand it a little bit. But we do invite you to listen to our other 2 Cancer Walk podcasts so you can get to know some of the other folks on this mission. For this time, I'd like for us just to kind of elaborate just a little bit more on the cancer programs in our region and the services that you provide, but also their impact on our region, being able to have that close to home. We touched on that a little bit in our last episode. I would like to dive into that a little bit more and, not just why this effort is important, but why it is so important to have our hospitals in our region here and what patients, how they can benefit from that. Dr. Walters, since you are a physician with Massac Memorial, I'm going to start with you if that's okay.
Absolutely. So the hospital has been here since 1956, and it has been servicing the community ever since that time. We have expanded. We've kept up with the times. We've moved into an electronic medical record. We've recently revamped and upgraded our imaging suite. So we have some of the state-of-the-art MRI, CT scan, mammography. As you said, bringing that care to the community. You don't have to travel 2 to 4 hours to get to some of the bigger places, such as Vanderbilt or Lexington or St. Louis, when you can get it here in town. So for cancer in particular, maybe we need an MRI, maybe we need a low-dose lung cancer screening, and linking with the clinics in town to try to make sure that the patients are being reached. Whether or not we have surgery, as an example, the ability to do things like colonoscopies and trying to care for the individual where they are at. We have a lot of individuals who can't get around, who may have either mobility issues, driving issues, resource issues, and it becomes very difficult for them to make those long distance travel. So in that case, being able to give that care to them where they are at is really important.
Okay, very good. Thank you, Dr. Walters. And he brings up something that a lot of us, who live in a rural community, we tend to think very rural, when it comes to our healthcare, and we don't really stop to think that there are advancements going on all the time. They're connected with resources throughout the region, such as Siteman Cancer Center and so on. It's not your grandma's hospital system anymore. And so, that's what we want people to realize, is that you can get cancer care here close, and a lot of it without having to travel to see your oncologist for every visit. So, Dr. Walters, thank you for bringing that up.
And beyond even healthcare,
yes,
looking at making sure there's clean water. The hospital's looking at making sure there's internet availability. We're partnering with more than just a doctor-patient relationship. The hospital is a beacon of the community, and it's integral for all of the access needs that a patient or an individual may need. So whether or not you're doing a community needs assessment or those types of things, mental health is important. Cancer screenings are important, but even access to food and water. Many areas, even in our area, don't have supermarkets within a certain distance. So we talk about cancer and things. If we have an unhealthy body, cancer is going to be an increased risk just because of access to basic necessities.
Exactly. And you got that connection with other organizations and facilities like, Massac Mental Health and other resources that are available to you and to your patients as well, correct?
Yes. So mental health has been also brought to a hospital. We have a psychiatrist that works with us. He partners pretty well with the Massac Mental Health itself, and there's a good partnership going there. Mm-hmm. All of that plays into the overall health of the community and the individual.
Well, yeah, and you bring up the exact right point in terms of it's not just about physical health, it's well-rounded health. And in making sure that the patients have what they need. Because if they're spending money on their health care, maybe they're not spending it on other things such as food or other necessities. So when you live in a rural community, we're able to connect each other up and have that there. And some of those entities will be at the Cancer Walk for you to have that information. So thank you for bringing that up, Dr. Walters. We appreciate it. Harry? Tell us a little bit about cancer care at Union County Hospital. How do you work with patients close to home?
Yeah, well, as you know, cancer care is pretty close to all of our hearts. I think it's touched everybody's family at one point in their life. So what we do as a local hospital is we try to support the care when they come back from the larger medical centers, having had cancer surgery or having had chemotherapy or radiation therapy. They travel for many of those things in our region, sometimes 30 minutes. Some of the people we know in our community travel 2 or 3 hours to get those types of treatments. So our job is when they come home is to give them a place to come and get their medications that they need. If they need some IV therapy while they're home, they can come in and receive that as an outpatient. If they have certain injections of medications their doctors are prescribing, they don't have to drive all the way back to the big hospital. They can get those done here locally. In our emergency room, probably one of the biggest points is folks come home and they get sick after chemo, they get sick after radiation. They oftentimes come to our emergency room for help. To help settle their stomachs, to help get them calm and pain medications and those types of things. So that's how we partner with the big centers around us to bring care back home to those people who are traveling.
So you work closely then with the hospitals throughout our whole region and making sure the patients get what they need, correct?
Yep. And it doesn't matter whether you're going to St. Louis, if you're going to Evansville, if you're going to Carbondale, wherever your cancer care is, we coordinate with them and take care of patients close to home.
Okay, great. Todd, tell us about your region down there and what folks tend to expect with the hospital as well as with the region as a whole.
I think one of the things that has happened, healthcare is always changing. There's always new advancements coming and things of that nature. But especially over the last 10 or 15 years, there's been a lot of opportunities presenting itself with advancements in being able to offer things digitally and being able to get interconnected with other facilities and with resources. For instance, when the hospital moved from film to digital x-rays, it opened a whole new world of being able to get readings back quickly with outside radiologists. We were a partner with our internet service provider in bringing fiber to our rural area. So it didn't just help the hospital and being able to allow us to send scans, for instance, to a radiologist quickly. It also brought fiber to the community, to the school, to the residents of the area. And we were a partner in doing that and in bringing the funds to this area. So I think as we see, we've talked about being in a healthcare desert and people having to travel a long distance in order to see specialists and to be able to get the care that they need. one of the aspects of that makes it such a dire need is the lack of transportation, people's lack of access to healthcare, and being able to do more at these rural hospitals in rural communities allows people to get care closer to home, where usually the people are more comfortable getting their care close to home. And so I think what we've been able to do as a rural hospital is to use the technology to bring care closer to home for the residents in this community. And even though we don't have an oncology program here where we're actively doing chemotherapy and radiation and things of that nature here in our community, we can support the oncologists in this area by allowing people to get as many services, screening tools, and procedures done here locally that can reinforce those efforts.
Oh, very much so. And it brings up another thing. Telehealth is becoming a big thing for our reason. It's still somewhat of a challenge over in Hardin, Pope County, where you are, Todd. Oftentimes, there's not the internet accessibility. So I'm glad to see that you're really working with those partners to make that happen over there. In some areas, there's not even cell service where you are.
Exactly.
So are any of you, I'm sure Siteman does, but are any of you rural providers, are you providing telehealth medicine? Is that something that's happening or coming, or?
We are at Massac. We started basically the week COVID happened back at the end of December of 2019, had to build that and implement that. But there are limitations for rural health for using telemedicine, virtual visits, for telephone encounters and things of that nature. So this is not just a ability to provide it, but we're also working with governmental entities and bodies for legislation change, because there's a lot of places that don't allow rural clinics to use some of these resources that private practice and some of those others can use.
Yeah, so the technology's there, but regulations, being able to bill for these things, and we have the capability of doing things that maybe the regulatory bodies don't recognize as a legitimate visit or a legitimate contact between the provider and the patient.
I concur wholeheartedly with that. So if you're up, let's say, Springfield, Chicago, where you have a large proportion of providers to populace, you may not need these things and they may not see why it's valid. But when we're talking about a large area of land with very few providers per person, now this provides access to care that may not be available. And so he's right. We have the tech. The problem is now, can we actually use it and keep it sustainable?
And see, now coming at it from a public health standpoint, because I'm not in the weeds like you guys are. So I just assumed it was a technology issue, and it's not so much that for a lot. Oh, wow. Okay. Learned something new. Did not know that.
Donna,
Yeah. Yes. Yes, Don.
And just to tag on to that, as Dr. Walters mentioned, Massac is working closely with the Massac Broadband Committee work to get more access to folks in the Massac, much like.
Oh, you're cutting out, Don. I'm sorry.
He was talking about with the fiber, how the hospital is bringing into the region. We're looking at making sure that there's adequate wireless connectivity for schools and public, et cetera.
Gotcha. Okay. Yeah. So in some instances, it still is a connectivity issue, but there's other moving parts with that I wasn't aware of. Okay. Wow. Interesting.
Yeah, and that's a big part of why, having voices from Southern Illinois in the conversations at the state level really helps, because a lot of these types of challenges are flying under the radar for a lot of the folks. They don't think about just the logistics of accessing healthcare and some of the challenges that are faced by our rural community partners. But yeah, a lot of the, that billing and that compensation, that's huge. And those are the types of things that I think, if the whole state kind of gets together as a team, we can tackle those types of challenges and at least make that one less barrier that the patients have to get through. Telehealth is so so much easier for so many patients for a variety of reasons, whether it's their transportation and their access to vehicles or rides, or just being immunocompromised for, sometimes just getting out of the house is exhausting, and, and you don't want to risk getting sick during cold and flu season by going up to the hospital. So anytime we can provide those sorts of services to our patients, it's a huge benefit.
Okay. Oh, very good. So there's a long conversation there that needs to be had.
Yeah.
For folks in our region. And that's what we want people to be aware of, and want them to understand that these are things that we are working on. They end up making sure that their health care is there, it is effective, and meets all of their needs. Okay, so we've been looking at and talked about, in the last couple of podcasts and today as well, as far as the services that we are providing. In terms of this particular event, which is the Cancer Warriors Walk for Hope, what are some things that you want people to get out of this day? We've talked about it before, but again, we might have a new listener. What are some things that we want people to really take away from this event? Don, let's turn to you.
Can you hear me okay?
Yes, we can. Thank you.
I think just availing themselves of information and education, and the folks that are going to be there presenting and having tables set up, showing a united front, I guess, in educating the community on all the services we all have. I think that's going to be integral to folks combating cancer and just availing themselves of information. And I feel to be able to see all of these entities who historically in the past have always vied for a lot of the same patients and things, coming together and saying, listen, we don't care where you go, just as long as you go get taken care of, wherever you're comfortable, and just make sure that you're getting checked out if something doesn't seem right. But like Dr. Walters had mentioned in the previous podcast, we need to get ahead of that. We need folks to be aware in advance and be proactive, because oftentimes by the time you start feeling like something's not right, it could be too late, quite frankly. So you've got to be very much aware, and I think just sharing education is going to be huge for folks that might attend this event.
Exactly. Anyone else have anything to add to that?
I like patients to know. Oh, go ahead.
I'm sorry. I just want to add to what Don and Dr. Walters and Sarah mentioned. Education is very important. So as a partner at Siteman Cancer Center, we do have the 8 ways to stay healthy and prevent cancer. It's just 8 simple steps for people to know of how they can reduce their risk of cancer. Of course, we can't control for the genetics all the time, but just having those 8 preventative steps are very key for you to reduce your risk, like exercising, reducing smoking, things of that nature that can help a person thrive along the way. And then also, as Don mentioned, it's important for people to know where to go in rural areas, because as Sarah mentioned, you can't travel all the way from the Southern 7 area and all the way to St. Louis. It's just really too far out. And so knowing your local clinics is important. And so that's why I think it's important for all of us to just kind of share information of where our clinics are located and just promote getscreenednow.com so people can know, where's the nearest clinic based on where they live.
Yes, definitely.
To piggyback on that,
Dr. Walters,
I try to tell patients that they're my boss, not the other way around. There's a big distrust. There's a big question on who's the actual authority body when it comes to the encounter and things. I'm not telling somebody that they have to do these things. I'm recommending them as if they're my mom, my sister, my brother, my cousin, and you've not had the opportunity to have 15 years of medical education. Mm-hmm. So if I'm taking my car in and the guy goes, hey, you need new brakes, I'm going to listen to him. But I don't necessarily feel that patients are aware that they have that right and that privilege, that this is their visit, not ours. We are hoping they trust us with their time and their family members, because it's a big deal. These are lives, these are people's futures. And I want them to know that this is their journey, and I'm happy to help them with that. So if I can give them today I can talk to them about stopping smoking and they say, no, thank you. I say, okay, you're welcome to tell me no, thank you. But I'm still going to tell you it because I care about you.
Yeah.
And I think there's a big piece of that gets lost somewhere along the way. And I don't know if it's at the patient level. I don't know if it's at the society level. I don't know. But I think it's gotten worse through COVID, that there's just a big trust issue, that there's a lot of opportunities that are there, but now people are just afraid. They're just afraid.
Well, yeah, I mean, they think that they're going to be judged, or that there's going to be a stigma put on them in some way. I mean, we want people to know this event is an opportunity for you to come and open up and to talk with providers, and maybe even get a doctor if you don't have one. This is a safe event, a safe space for that. But you're right, COVID really has changed how people see medicine. It's going to take us a while to get over some of that, not just vaccines, but in general. And hopefully this will be a turning point for some people when they're making those decisions. Okay.
And it helps for that one. So my idea is the parable of the starfish, right? Little grandma and a little granddaughter walking along the beach, picks up a starfish and throws it back. The grandma says, stop, it doesn't matter. The little girl picks up one more, throws it back, and says it mattered to that one. So that's my mindset when I'm trying to get through a busy day, trying to deal with just that one extra patient every day, is that it may be this is the one that we reach, and every single one should have that. And from what I've seen with rural hospitals, critical access hospitals, patients at Massac, patients at Hardin, etc., I mean, the care and the love is there. We are welcome. We are waiting. We are hoping that we can give that care to you guys. That's what I want to give with these types of events, is to let them know that we're here. The whole "we'll leave a light on for you," that's already probably patented or copyrighted, but that's the idea, is we have the resources, we have the time, we have the interest, and we are invested in the care of the people in the community.
Yeah, that's a huge part of it. Like, you know, the health of a community has more of an impact than nearly anything else when it comes to the outcomes for patients. You know, the health begins in the community. That's where you live your day-to-day life. And so your ability to access resources that are going to allow you to make healthy choices is going to impact, you know, your overall wellness, but it's also going to affect your family members, your friends. So having events like this where we encourage folks just to get out and go for a walk, you know, maybe that builds a healthy habit where you all get out and go for a walk, and that's good physically and mentally. Maybe it's like, you know, starting a walking club in your community, or doing something where you can just kind of get out and away from sort of that isolation that we all experienced during the pandemic. You know, anything we can do to kind of bring the community back together physically and mentally to support one another. I think that's really benefit of events like this.
Exactly. I like the idea of a walking club. That's a good idea. They have other partners to help you with that. Let's talk about the future of cancer care in our region. You know, in our last podcast, we talked about how we are starting to do genetic cancer testing in the lower 7 counties in Illinois, and we provide FIT testing now for anybody who wants at-home colon cancer screening. What are some other things that are going on in your hospital systems that you're seeing down the road? Maybe something you're getting ready to implement. Maybe you're not ready to share, that's okay. But what are some things that you're seeing coming down the pike for you here locally?
Harry, what are you seeing for Union County Hospital?
Well, what we hope to be able to do in the future is to continue to develop, as Deaconess Illinois, partner with our other sister facilities here in Illinois, which are in Marion and in Mount Vernon, to improve cancer care in the region and offer more services. Because as you know, these days and age, getting into healthcare in America is difficult. Getting a CT scan you can wait 4 or 5 weeks. Getting an MRI can take 6 weeks. So we want to start partnering with everybody around us that has those backlogs. We generally, as a small hospital, can get you in for a CT or an MRI today. And so, you know, if I go to the doctor and he says, Harry, I think maybe you have a tumor and we want to get it checked out. I'd like you to get a CT. I'd like you to get an MRI. I'd like you to get an ultrasound. We can do that today. Other places can't do that. So what we want to do in the future for healthcare and for cancer care in Union County is reach out to people and say, hey, let your doctor know that we understand that they may be in St. Louis, they may be in Carbondale, they may be in Marion, they may be in Evansville, but we can actually get your test done today. And that means you're going to get the result faster. When you get the result faster, we can advance your care faster, right? And we all know in cancer care, we don't want to wait 6 weeks to let my cancer grow while we wait and find out what it's really going on, right? We want to know, oh, Harry, that is a tumor. By the way, we're going to get you started on care today, or we're going to get you started on care next week. Because the faster we can start that care, the better the outcomes are.
Todd, what are you all seeing over in Hardin County?
I think in a general sense, or in just general terms, not getting into too specific yet, but we're seeing more and more partnerships of between providers and between facilities, sharing staff that spend a few days in each individual hospital or each individual clinic setting, so that rather than getting the patients away to where they need to go, we're bringing the providers and the specialists to the patient, whether it's through technology or through perhaps a provider that spends a day in Massac, a day in Hardin County, a day at another facility, to where they can see patients where they are. We're getting to the point where we're able to bring more services to the patients in the local communities, I think.
Dr. Walters, were you wanting to add to that?
Yes, similarly. So using things like telehealth, we have a mobile unit that we actually send out. It's a very large RV clinic that we send out to several sites. Yeah. That's been well received. As of yet, we're still working on building and implementing and growing that particular outreach program. Looking at partnering with the schools, looking at partnering Southern 7 Health Department, trying to make sure that the vaccines for children is going well, make sure the lead screening is going well, make sure that all of that is happening. There's still, we talked regulatory before, what does the genetic piece look like? I know there are insurance issues with that. There are legal ramifications for genetic testing, DNA testing, and such. So again, that goes back to some of the fear and who has this data. Large national public data breach recently. I mean, there's a lot to unpack with all of that. And education is the thing that we can do. And it is something that we have lots and lots and lots to provide.
Yeah, I tell you, like Todd was saying, we do partner with each other very well on things, not just on events like this, but making sure that our patients are getting exactly what they need. I've gone to an event at Rural Health where we were set up at the health department, and Massac Memorial had their mobile van there. You know, that's what it takes in this part of the country to make sure that we're all focused and working together. Don, do you have anything to add to that conversation?
No, I think just chiming back in, I think that's all around the mindset of why this walk is so important, is it shows a united front. We realize we can't be siloed any longer. I mean, we're going to have to be there to help each other out. Right. And in any way, shape, or form that we can do that, we need to do that for the betterment of the health of our citizens in this area. I can't speak for Hardin or Union County necessarily. I'm assuming and imagine that they definitely do this as well. But I know at Massac, we really try to focus and evaluate every 3 to 4 years, you know, our strategic focus going forward, evaluating our equipment. We just recently reinvested over $2.5 million into our mammography services, our CAT scans, MRIs, all the imaging equipment was all redone in advance here just in the last year and a half. So reinvestment into equipment is very important. Embracing technology in general. AI is something that's coming down the pike, and it's not going away. Artificial intelligence is coming. How do we harness that so that we can better take care of our patients in all areas, including oncology and cancer-related issues? How can we do that? So I think that's part of our strategy going forward is embracing that technology, not running away from it, bearing our heads. It's looking and pushing and pulling and figuring out how can we make that work. And perhaps we partner with other folks to make that happen. I don't know, but we're keeping our eyes wide open so that we can figure out how can we best impact patients in our area and do it in the most cost-effective manner we can, and using all the resources we have before us to make it easier for patients to get that care and not have to drive 2 hours away to get care. How can we make it happen here at home? And I feel I can speak confidently. We're doing it. I'm sure Hardin and Union County are doing it as well, speaking in terms of hospitals specifically. And I'm sure FQHCs are also being good stewards of their resources to figure out how can we advance care. So,
Right. I mean, well, we're living in a time when medicine just advances by leaps and bounds almost daily. I know Sarah sees that a lot at Siteman. And so it is something that we have to stay on top of, and why it's so important that we work together and we keep our communities, as informed as we possibly can. But Dr. Walters and of course, Don, all of us have had the conversation of, the last few years has just made patients leery of anything that we do. And it's just going to take time, a lot of education, and we just want people to know that we are here and are trying our best to figure it all out to make sure that you are getting the information that you need. Because listener, we want you to realize we're patients too. Yeah, we may sit in the office and we talk with patients, but we are also patients. And so we have a lot of the same concerns that you have. And so this is an opportunity for you to ask us questions and for us to come together to make sure that we're getting all that information to you that we need. Sarah, do you have anything you'd like to share there on Siteman's behalf and what you're seeing?
No, I mean, there are so many different options available to patients now that we didn't have even 5 years ago. Like, cancer care is changing quite a bit. And so that's why we really encourage people, even 20 years ago, most people would not want to even get diagnosed because there really weren't options available to them, but we have options. So our main goal is really to make sure that everybody has access to all of the options, and that we can connect our partners to those different opportunities, whether it's a certain type of tailored treatment or like biomarker testing or even like clinical trials access. We try through our group PCAD, we really try to be mindful in how we're designing our clinical trials so that we can encourage good participation from our rural partners and in rural communities. Even if it's something as simple as like the timing of the visits, making sure that if you're part of a trial that we coordinate it with a time you're already going to be in town. There are some little steps that we can take to make sure that people have access to these really cool new options and treatments, and that they don't feel like a cancer diagnosis is the end. It's just, that's the start of the conversation, but it is a conversation, and it takes a village to support you through the journey locally, regionally, depending on how specific or unique your situation is. But we just want folks to know that you've got great healthcare partners in this region, and definitely don't hesitate to reach out to them with any questions.
Very good. Well, folks, that just about wraps up our time for our podcast. Does anybody have anything else they want to add?
We assume too much that people know what is available to them are in our community. And so educational opportunities like this, you can't do too many of them, because you're always someone out there that you might be able to reach that wasn't aware of a screening, wasn't aware of a procedure, wasn't aware of a service that's available to them. And so that's why things like this are so important.
Exactly. Yes, Todd, I agree completely.
And to remind them that they are a person and not a statistic. I think that's part of the thing that these events matter for. They're not a number in a trial in some sterile room somewhere. They are an actual entity, as are we, and they're not just a number somewhere.
Exactly.
Yeah, cancer affects the whole family and the whole community a lot of times. So, getting your group of people together to kind of celebrate the victories of our neighbors, but to also just recognize that there are resources available to help you throughout the journey. But just opening up that conversation is so critical.
Cancer is a devastating disease, but it doesn't have to kill as many people as it does. That if we all take the time to study ourselves on a regular basis, look for those signs and symptoms. Is there some discoloration on my skin? Am I having headaches too frequently? Am I nauseous all the time? What are those signs? Am I losing weight for no known reason? Right, that's a big one.
Yeah.
I want people to understand the signs and symptoms of cancer so they can identify it themselves, but also maybe even identify it in others around them and say, hey, have you had that checked out? Because I care about you.
Mm-hmm.
And to be able to speak, I want them to know it's okay to speak up and not just assume everything's okay. Because I think that's where we falter, is we just say, oh, surely there's nothing wrong. No, let's get it checked out and make sure there's nothing wrong. That's what I want to take away.
Very much so. Well, folks, I want to thank you. Go ahead, Don. Yes, please.
Just wanted to say thank you for putting this all together, you and the Southern 7 folks, the health department, everybody on this podcast. Like Todd said, you just never know when one person can be impacted, and this podcast being archived, I guess, where people can see it and hear it, you know, it impacts somebody. So thank you for putting the podcast on. Appreciate that.
Oh, no problem. We're happy to be able to help share. And, you know, if listener, if you're not able to come to the Cancer Walk in October, we just want you to know that there are people here who want to talk to you and are here to help you and to answer any questions that you have. So please don't hesitate to reach out and get the information that you need. But we would love for you to join us. Again, the Cancer Warriors Walk for Hope is going to be coming to the Metropolis. It's going to be at the Dorothy Miller Park on October 5th from 10 to 2. There is still time to register for the walk. You can actually register for it the day of the walk if you can't prior to. But there's lots of opportunities to do that. You can just visit us online at Cancer Warriors Walk for Hope. You can check out our Facebook page and our Instagram page, or you can give any one of us a call any of the departments, call the hospitals, rural health, Chessie, whoever you want to call, reach out to us. We'll make sure that you have that information. But again, we want you to come out and have a good time. The walk is not like a 3K or a 5K. It's just a nice little stroll around the park. You can walk as many times as you want, and your donation goes to help increase and impact the cancer programs in our region provided by the hospitals here today, as well as our rural communities. So please make sure that you participate in that in any way. We are still looking for vendors. If you'd like to set up a booth, if your business or agency or organization works with cancer patients in any form, get in touch with us, and we'd love to have you involved in that. Also, if you would like to actually be a sponsor in the effort this year, we are welcoming people to come and be a sponsor and support the event. We'd be happy to share all that with you.
Well, thank you for listening to this episode of the Southern 7 podcast. If you'd like more information about this year's Cancer Warriors Walk for Hope, please make sure you check us out on Facebook at the Cancer Warriors Walk for Hope, or you can give us a call here at Southern 7 at 618-634-2297. Again, that's 618-634-2297. And before we leave you, we do want to invite you to check out all of our other Southern 7 podcasts. Again, you can download them on the Southern 7 app or listen to them at southern7.org. You can also check them out on Spotify. From all of us here at Southern 7 Health Department, as well as all of those associated with this year's Cancer Warriors Walk for Hope, we hope you have a wonderful day.
Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
The second annual Cancer Warriors Walk for Hope is coming October 5th from 10 to 2 at the Dorothy Miller Park in Metropolis, Illinois. Your whole family will enjoy this one-of-a-kind event complete with games, food, and activities, a tour through a 20-foot inflatable colon, the chance to meet local cancer care providers, and so much more. It all starts with the Warriors dedication ceremony at the Hope Light Lighthouse at 10 a.m., followed by the walk along Memorial Path on the banks of the Ohio River. All proceeds benefit cancer programs in Southern Illinois. For more information, visit Cancer Warriors Walk for Hope on Facebook or call 618-634-2297. Presented in partnership by Hardin County General Hospital, Massac Memorial Hospital, Union County Hospital, Rural Health Incorporated, Community Health and Emergency Services, Southern 7 Health Department, and the Hope Light Foundation.